decided that pain relief was unmanly. He tried to ban anaesthetics. In 1854, Britain and Russia went to war in the Crimea. It was the most severe winter in living memory. Dr. John Hall was appointed the Chief of Medical Staff. He had his own views about newfangled anaesthetics.
The smart use of the knife is a powerful stimulant. It is much better to hear a man bawl lustily than to see him sink quietly into his grave.
Hall believed that soldiers about to be operated on should be given a bullet or a leather belt to bite on, not chloroform.
John Hall had become the chief medical officer in the army. He'd been promoted up through the ranks. He had little experience of modern surgery and anaesthesia. He only knew what he had read in the journals and from anecdotal references that chloroform could be dangerous. As an army doctor, he expected the soldiers to be brave and withstand pain without the aid of anaesthesia.
Hall's edict split the medical establishment. Even the patients weren't sure if they wanted anaesthetising.
The average soldier was illiterate, but they were brave men, and they were afraid of this new anaesthesia because they thought, as they were going to sleep, they would give away their life secrets.
There was something in John Hall's view. In states of extreme shock, such as when soldiers had had limbs blown off on the battlefield, a mix of adrenaline and endorphins would often stave off the pain. But the effect would wear off and the soldiers would be in a desperate state by the time they reached the field hospital. The majority of surgeons ignored their commander's instructions and used chloroform.
The doctors in the Crimea did not follow John Hall's instructions. Most of them had been trained in Scotland or Ireland. They knew the benefits of chloroform. They did not want to see men screaming and crying with pain when they knew they had chloroform. Not only that, they were able to take a little longer with the operations. They were able to stop the bleeding, and therefore the men would be more likely to survive.
But whilst it was good in battlefield situations, chloroform wasn't the perfect knockout drug. The first patient to make that clear was 15-year-old Hannah Greener. In January 1848, Hannah was about to have an operation to remove an ingrowing toenail. The doctor decided to use chloroform. It was a fatal decision. After going under, Hannah turned pale. They tried to revive her by giving her tots of brandy and opening the window. But Hannah had died, the first recorded fatality of chloroform.
I think Hannah Greener died because she was so nervous. The nervousness created a lot of adrenaline in her body. That combined with the chloroform to cause a dysrhythmia in her heart, and because she had that dysrhythmia, the heart stopped.
Until the 1860s, the problem with anaesthetics was that they knocked the whole patient out.